The muscles we're going to focus on today are the gluteal muscles. So we have three gluteal muscles. So we've got the gluteus maximus, which is the largest muscle of the body. Its belly is in the buttock region. It actually has its tendon attachment all the way down to the knee. This is called the iliotibial band. And this actual area often gets sore in runners when they're taking too much load through the tendon and not enough through the actual muscle belly. We then have our gluteus medius. The medius is a bit more above and lateral on the outside of that iliac crest, and it actually helps stabilize the pelvis as well when we're walking and standing on one leg. And if you take the glute medius and we cut that away and we have a look here, the muscle underneath that, that's the glute minimus. We also have our piriformis muscle, which connects the front of the sacrum across to the actual hip itself, and people will often have problems with this muscle, will end up with an entrapment syndrome of their sciatic nerve, and they can get sort of pseudo-sciatic type symptoms. The importance of actually working the glutes and having the glutes doing really well is that actually it holds the pelvis together well, so that when you stand on one leg, you don't actually have to strain muscles on either side above the pelvis, which will actually strain themselves to actually work a bit too hard. And the better the glutes are working, the hamstrings don't have to do as much work. And so the stronger the glutes and if they're firing well and they've got good activation, you'll actually probably reduce some of that hamstring tightness that people will develop unnecessarily. If we now turn the body around and look at the muscles from the front, this is the front of the spine. The abdominal contents have been taken away. This here is part of our hip flexors, our psoas major and psoas minor muscle, our iliacus. And this particular muscle here, just above the iliac crest, it joins onto the 12th rib, the bottom rib, and it bends us to our side. But this muscle will often overstrain when the glutes aren't working well, as it tries to help stabilise the pelvis. And the better your glutes are working, the more likely that muscle won't strain itself and or irritate the muscles and fascia above it, okay, the thoracolumbar fascia. Because above this fascia, on this side and on this side through here, you've got some little nerves that pierce through that area. These are called the superior cluneal nerves. And we'll talk about that in another segment. So how are we going to actually target the glute muscles to actually strengthen them up? One of the best ways is through isometric contraction. And isometric contraction is when a muscle contracts, but it doesn't shorten and it doesn't lengthen, so it stays in the same position. So we're going to use some bands. So bands are resistance bands, great, just rubber bands. They're quite inexpensive. They come in all different colours and things. You got sort of light ones, medium, firm, extra firm, and for the ninja there's always a black one. So we might start off with a patient on a yellow or red strap. The best distance to get is a 27.5 centimetre loop, because that goes just nicely around the knees. So let's do a few of these exercises and we'll show you what you've got to do. So what you're going to do is you're going to place a band just above your knees, evenly on both sides, and then you're going to lie down onto your side in a comfortable position. And I want you to bend your knees and line your feet up directly with your spine, okay? And so you can put up a pillow here if you'd like to, and then you're going to just do a clam exercise. So a clam is when you open up like a clam shell opens, and instead of going in, out, we're just going to hold that position for up to a minute. Now, if you get 10 seconds in and it's too difficult, the band is too firm. If you're getting a minute and a half in and you're not feeling much at all, the band is a bit too light. So by about 45 seconds, you really want to be feeling it. But where do you want to be feeling it? You actually want to be feeling it in the glute. So a lot of people will actually feel it in their quad, and that can just be a positioning thing. So we're going to change our position to get it more for the glute rather than the quad. Well, they'll often feel it on their inner thighs, which is quite paradoxical, not where you should be feeling it at all. So persist for a moment, but if you're feeling it in the wrong place, just stop and swap and do the other side. And you'll often find one side is much better than the other. So you're going to hold that for up to a minute. When you're finished getting close to a minute and you can just time yourself, just slowly lower it down. We don't want to see people sort of go blop. And just that nice, slowly lowering it down, okay? And then you're going to swap over and do the other side. Then come back to this side again, and now you're going to lie dead straight, okay? So line yourself up nice and straight, And this time you're going to push straight up to the side. Now this you're going to feel in a slightly different spot. This is going to more activate the glute medius muscle. So just a little bit higher and a bit more lateral. So before you were getting more of the glute max. So now you've got the glute medius, and you might find this one's a bit more challenging. Okay? So you're going to hold that. Again, if you're not getting much of the burn, you may not be pushing hard enough, so just push a little bit harder, and that little bit extra you push makes it quite significantly more difficult. So you're going to hold that for up to a minute, and then slowly lower that down, and then swap over and do the other side. From here, you're now going to go onto all fours. And so you're on all fours. Now we're going to do what's called a fire hydrant. And so you'll understand why it's called a fire hydrant in a moment, because what we're going to do is we're going to basically just cock our leg off to the side, as if we're doing something on a fire hydrant, and hold that position. Now it's important that the whole pelvis doesn't twist, okay? So you want to keep all this nice and flat and level, and it's purely just a hip movement. And so we've got external rotation and extension of the hip, and you hold that there. You'll actually feel that in both gluteal muscles. To make it more of a challenge, if you like, you can actually take the arm off, and we can do a alternate arm and leg. Hold that position there. This will also activate your transverse abdominis, and it'll do some work on the shoulder stability as well. So you're holding out to the side just like that, and then lowering that back down. And then you're going to do that on both sides. From this position, we're going to stand up. So let's have a look at that. So in our standing posture now, we're going to actually do a pushing the leg straight out to the side. This will activate the glute medius on both sides. People can feel it quite quickly. Importantly, it becomes a balance exercise as well. If you do feel a bit unbalanced, you can hold the back of a chair or put your fingertips on a wall, and you're going to hold that. You will see that your body has to transfer the weight over top of the leg that you're standing on, and that is okay, and that's normal. So you're going to hold out there, you're going to feel it on both sides, and you're going to do that again for up to 1 minute. And then swap over and do the other side. And then you're going to do another fire hydrant, but a standing fire hydrant this time. So in this one, you're going to put the leg abduction, external rotation, and extension. So just cocking the leg out to the side. Now, some people do this incorrectly, and what you'll find is that they've got hip flexion. So we want to make sure you stay in that nice front plane with a little bit of extension, external rotation, and abduction. And you're going to hold that for up to a minute. That really works the glute max. So from there, things should be burning, and you should be really feeling both sides. It shouldn't be painful. If it's painful in the back, you need to stop. If there's any discomfort at all, don't continue with these exercises. You definitely need to talk to your practitioner. But in majority of cases, they should not be sore at all. So from here now, you can then do some glute activation through just a squat, and you can do that in that position there, just to sort of put a bit more tension through those as you're pushing out through the band. If you really want to, you can actually also go down into a deep squat and hold that position there, keeping the heels on the floor. As with any back problem, it's very important to make sure that the underlying diagnosis is correct. So it is important to talk to your doctor or practitioner that you're seeing for your back to be sure that any of these exercises are appropriate for you. If, however, they can form a great way of you to shift the pressure away from that quadratus lumborum and away from irritating those small nerves, which will often give a lot of that pain. And you're actually, think of these exercises more as a brain training exercise, getting you to use the appropriate muscle and use that muscle correctly. Because a lot of people will go to the gym and they will do their glute exercises, and they will do their squats, and they'll do their lunges. But you ask them, are you sore in your glutes the day after training or 2 days after training? They get that good soreness in those muscles. And they'll often say, no, I don't ever feel that. And they're really feeling it in their quads. And that's because they've become quadriceps dominant rather than glute dominant when it comes to hip extension and actually driving up into a standing position from a squat. So let's get those glutes active. Use isometrics. They're a very safe way to exercise the glutes without actually using any additional weight and without going through a lot of repetitive motions. So you just hold the position for a period of time, and then let those muscle and the muscle memory sort of really burn into that muscle, and then come back out again, do the other side and back again. and see if it actually helps reduce that back pain. Thanks again, Brent Gordon from Shirley Road Chiropractic.